The vaccine against the virus that causes COVID-19 is on its way to Hamilton County.
48 hours from right now, potentially, we're going to have it in our building.
The initial shipment of doses will arrive at Riverview Health and IU Health North on Thursday and will start being administered to frontline workers on Friday.
We're planning to give about 215 vaccines a day. That number will incrementally increase over time.
It's a day they've been planning for since the spring.
Thought that science is going to win and we're not going to be slaves to COVID by this time next year is overwhelming. Thought that I won't have an ICU full, we'll be able to get back to more normal stuff is enough to really bring some emotions to the front.
But IU Health says it's important to remember that frontline workers are just a small part of the population receiving the 2-dose vaccine.
Even with that first group, you're looking at mid to end of January before they're done with the vaccination process.
Planning hasn't been easy. For one, the Pfizer vaccine must be kept at extremely cold temperatures.
We put in an order in July for a freezer that can keep it at minus 80 Celsius.
But that's not the only obstacle.
Once you mix it up, there's a very strict, I believe it's 6-hour window, and it has to be used. Not only do we have to have the staff available to mix it properly because it's a little more complicated than most vaccines, but we're also supposed to have people standing by so that if suddenly we have 1 or 2 doses left at the end of the 6-hour period, we don't want any of them to go to waste.
Of the thousands of people who received the vaccine in the UK ahead of the US, only 2 people have had severe allergic reactions. That's an extremely low risk, but Riverview Health says they're prepared.
Crash cart and adrenaline available to give people.
Riverview and IU Health North say they'll be providing vaccines to more than just their hospital staff. It'll be for frontline workers across Hamilton County.
And the FDA has now authorized the first at-home test for COVID-19 that does not require a prescription. Now, this is an antigen test, so this means it detects proteins of the coronavirus with a nasal swab. The sample is then analyzed with a device that's connected to a smartphone. The results are then sent to an app in just 20 minutes. This one should be available in drugstores next month for about $30.